Most people have no idea that pancreatic cancer is one of the deadliest cancers known today, quietly surpassing breast and prostate cancer in mortality rates across many countries. What's even more troubling is that it continues to fly under the radar, drawing little public attention despite its rising numbers. Picture this: by learning just a few key symptoms, you could help yourself or someone you love catch this disease before it's too late. Pancreatic cancer is often called a silent killer for a reason. With a 5-year survival rate hovering around 12%, it is a master at hiding in the body, claiming over 65,000 lives each year in the US alone. What's terrifying is that nearly 80% of patients overlook early warning signs, brushing them off as minor issues or everyday discomforts, until the cancer has already advanced and spread. But here's the crucial fact: research now shows that many of these symptoms start appearing as early as 3 to 6 months before a diagnosis is made, offering a rare window of opportunity for early detection. Your pancreas, although small and hidden deep in your abdomen, has an enormous job. It helps regulate blood sugar and produces vital enzymes for digestion. Because of its hidden location, tumors can quietly grow without triggering immediate alarm, which makes recognizing subtle warning signs all the more essential. In this video, we're going to reveal 8 surprising signs of pancreatic cancer that you might not expect, some so common that they're often dismissed entirely. And here's the breakthrough insight: according to recent scientific research, recognizing just 3 of these symptoms together could improve the odds of early detection by nearly 70%. Why does such a deadly disease remain so overlooked? Why is this knowledge not part of everyday health conversations? If you find this information helpful, don't forget to like this video and subscribe to stay informed about health topics that can truly make a difference. Let's get started with the first critical sign. 1. Digestive problems. Pancreatic cancer has the potential to profoundly disrupt your digestive system through several intertwined mechanisms. The pancreas plays a central role in digestion, producing vital enzymes that help break down fats, proteins, and carbohydrates into forms your body can absorb and use. When a tumor develops in or near the pancreas, it can interfere with enzyme production or block the pancreatic duct, causing a chain reaction of digestive problems that can be both uncomfortable and concerning. As the digestive process weakens, food may remain in the stomach without breaking down properly, leading to persistent nausea, vomiting, bloating, and an overall sense of digestive distress. Over time, this disruption creates a noticeable drop in appetite, as the body struggles to process nutrients efficiently. This often leads to unintentional weight loss, muscle wasting, and nutritional deficiencies, further weakening the body's resilience. One particularly telling sign of impaired digestion is a distinct change in stool appearance. Because the body can no longer properly break down and absorb fats, stools may become pale, greasy, and unusually foul-smelling, a red flag that's often overlooked. This isn't just a minor digestive annoyance, it's the body's way of signaling that something deeper is wrong. Recognizing these digestive changes as potential warning signs of pancreatic cancer could make a life-saving difference. While they might seem vague or nonspecific at first, understanding the connection between these symptoms and pancreatic function provides a crucial window for early detection and possibly better treatment outcomes. 2. Fatigue or physical weakness. Pancreatic cancer can rob the body of its strength in a way that extends far beyond normal tiredness. This isn't the kind of fatigue you feel after a busy day or poor sleep. It's a deep, relentless exhaustion that stays with you no matter how much you rest. Even after a full night's sleep, you may wake feeling as if you barely slept at all. Inside the body, cancer cells compete with healthy cells for energy and nutrients, slowly draining the body's reserves. Simple daily activities like walking, climbing stairs, or lifting light objects can suddenly feel overwhelming, making everyday life a constant struggle. But it's not just the body that suffers. This physical weakness is often accompanied by emotional challenges, including feelings of sadness, anxiety, or frustration. Many people also experience disturbed sleep, which only deepens the exhaustion and creates a cycle of both physical and mental strain. What makes this fatigue so dangerous is how easily it's mistaken for stress, aging, or overwork. Unlike normal tiredness, it doesn't improve with rest or relaxation. Instead, it lingers and slowly worsens over time. Recognizing this persistent, unshakable fatigue is key to seeking medical attention early, as it may be one of the few early clues in detecting pancreatic cancer. 3. Fever and shivering. Fever in pancreatic cancer often signals your body's response to the disease's inflammatory effects. When your pancreas becomes inflamed, it triggers your immune system's natural defense mechanisms. These temperature fluctuations can be particularly confusing because they often come and go. You might experience episodes where you feel intensely cold and shivery, followed by periods of high fever. This pattern differs from the steady fever you might experience with common infections. The combination of jaundice and pancreatic inflammation can create a perfect storm for temperature irregularities. Your body is essentially fighting on multiple fronts, dealing with bile duct obstruction, inflammation, and the cancer itself. When these fevers occur, they're often accompanied by night sweats and general discomfort. Unlike viral infections that typically resolve within a week, these temperature variations tend to persist or recur. 4. Blood clots. One of the most often overlooked and underestimated complications of pancreatic cancer is its profound effect on blood clotting. While many associate cancer with tumors or pain, few realize that pancreatic cancer can quietly set the stage for dangerous blood clots. This condition, known as hypercoagulability, means the blood is much more likely to clot than normal, especially in the deep veins of the legs. Deep vein thrombosis, DVT, is a frequent result, typically appearing as unexplained leg swelling, warmth, tenderness, and a reddish or bluish discoloration in the affected area. While these symptoms may seem minor at first, they carry a hidden danger. If a part of the clot breaks loose and travels through the bloodstream to the lungs, it can trigger a pulmonary embolism, a life-threatening medical emergency. What makes this process so alarming is the underlying cause. Pancreatic cancer releases inflammatory substances that upset the body's natural clotting balance, tipping it dangerously toward excessive clot formation. This creates a perfect storm inside the body, where clots can silently develop without warning. The warning signs of a pulmonary embolism are unmistakable and should never be ignored: sudden shortness of breath, sharp chest pain that worsens when taking a deep breath, and a rapid or irregular heartbeat. When these symptoms occur, they demand immediate emergency care, as minutes can mean the difference between life and death. Understanding the link between pancreatic cancer and blood clots can help patients and families stay vigilant, recognizing that unexpected swelling or breathing difficulties may be far more serious than they appear, and seeking help without delay can save lives. 5. Swelling of gallbladder or liver. When pancreatic cancer develops, it can create a cascade effect in nearby organs, particularly affecting your gallbladder and liver. These changes occur because pancreatic tumors often obstruct the bile duct, the vital pathway that carries bile from your liver to your small intestine. Your gallbladder, normally about the size of a small pear, can become noticeably enlarged when bile backs up. This enlargement happens because your gallbladder continues to store bile but can't release it properly due to the blockage. Similarly, your liver might become swollen as bile accumulates within it. This swelling can sometimes be felt during a physical examination, appearing as a firm enlargement beneath your right rib cage. Modern imaging techniques like CT scans and ultrasounds can clearly reveal these changes. The relationship between these organs is delicate and interconnected. When one system is affected, it creates a domino effect that impacts the others. Understanding these connections helps doctors piece together the diagnostic puzzle. Healthcare providers often check for these organ changes during routine examinations, as they can be crucial indicators of underlying pancreatic issues. 6. Gas or bloating. Pancreatic cancer can significantly disrupt your digestive comfort in ways that many people don't expect or recognize at first. The pancreas plays a key role in producing enzymes that help break down fats, proteins, and carbohydrates, ensuring smooth digestion and nutrient absorption. When a tumor develops in or around the pancreas, it can interfere with this delicate process, leading to sensations of unusual fullness and persistent bloating. One of the earliest and most telling signs is a feeling of early satiety, the sense of being full after eating only a few bites. This happens because the growing tumor can press against nearby structures like the stomach or small intestine, limiting space and altering digestion. As a result, meals that once felt normal can suddenly leave you feeling bloated, tight, or even slightly nauseated. Unlike typical digestive discomfort from overeating or minor stomach upset, the bloating seen in pancreatic cancer tends to be persistent and stubborn. It often doesn't improve with common over-the-counter remedies like antacids or dietary adjustments. The abdomen may feel noticeably swollen even when you haven't eaten, and the sensation can last throughout the day, making it difficult to ignore over time. What makes these symptoms particularly concerning is how easily they can be brushed aside or misinterpreted. Many individuals assume they're dealing with stress, indigestion, or age-related changes, delaying medical evaluation. But when feelings of bloating, fullness, or abdominal tightness continue for several weeks without clear explanation, they deserve careful attention and medical assessment. Recognizing these subtle but persistent digestive changes could offer a crucial window for early detection and intervention in a disease that is often diagnosed too late. 7. Tummy or back pain. The location of pancreatic cancer pain can reveal crucial information about tumor location. When cancer develops in the body or tail of the pancreas, patients often experience a distinct type of discomfort that's hard to ignore. Imagine a dull, persistent ache that feels like it's coming from deep within your upper abdomen. This pain often radiates to your back, creating a band-like sensation across your torso. Unlike typical stomach aches, this discomfort tends to worsen after meals or when lying flat. Your pancreas sits in a complex network of nerves and organs. When a tumor grows, it can press against these surrounding structures, triggering pain signals. Some patients describe it as a gnawing sensation, while others compare it to a constant heavy pressure. The pattern of this pain is significant. Initially, it might come and go, giving you periods of relief. However, as the disease progresses, the pain often becomes more persistent and intense. Understanding your pain's characteristics helps doctors differentiate between pancreatic cancer and other conditions. The timing, location, and nature of the discomfort provide valuable diagnostic clues. 8. Dark yellow or brown pee. Your urine color can tell a powerful story about your health. When pancreatic cancer develops, it often affects your bile duct, leading to a condition called jaundice. This occurs when bilirubin, a yellowish compound produced during the breakdown of red blood cells, accumulates in your body. Normally, bilirubin is processed by your liver and eliminated through stool, giving it its brown color. However, when pancreatic cancer blocks the bile duct, this system gets disrupted. Even if you're staying well hydrated, your urine might take on a dark yellow or brown shade, similar to the color of cola or strong tea. This change happens because your body is desperately trying to eliminate excess bilirubin through alternative routes. Many people dismiss this symptom, attributing it to dehydration or dietary changes. However, if this color persists for more than a few days despite proper hydration, it warrants immediate medical attention. This discoloration often appears before other visible signs of jaundice, such as yellowing of the skin or eyes. Understanding this early warning sign could be crucial for early detection. Pancreatic cancer is often silent, but its impact is anything but. What makes it so dangerous is not just the disease itself, but how easily its symptoms can be ignored, disguised as harmless digestive issues, fatigue, or simple discomforts. Yet as we've seen, these signs are far from ordinary. They are your body's quiet alarms, trying to tell you something is deeply wrong. By recognizing even a few of these early symptoms, whether it's dark urine, unexplained fatigue, sudden bloating, or persistent back pain, you may be giving yourself or a loved one a precious advantage: time. Time to seek help. Time to act before it's too late. The truth is, knowledge saves lives. And sharing that knowledge can save even more. If this video helped you understand the hidden signs of pancreatic cancer, imagine how many others could benefit too.